Hello, and welcome to this lecture on alcohol use during adulthood, risks versus benefits. So we know there are some benefits of moderate alcohol consumption. This usually means 1 drink per day for men, slightly less than that for women. To begin with, there's socialization associated with alcohol use. It causes relaxation in some people. And in some instances also we know there's a decreased risk for cardiovascular disease, also type 2 diabetes, and we're talking about serious moderation, maybe about 1 drink per day. However, these benefits cease the second the consumption ceases. The second you stop drinking, you no longer have that benefit over more. Therefore, it's not recommended by any government organization to drink to gain these benefits. And in fact, in your book, it lists for you under Table 16.6 a whole list of what happens with moderate use versus alcohol use when dealing with different diseases. So it really breaks down for you. If you look at here, even under moderate use, most things like for cancer, liver function, etc., there's no benefit of consuming alcohol, which is why, again, we talk about the idea, don't drink or start consuming alcohol because you think there's a benefit to it, even though sometimes we hear in the news, oh, it's good for heart health. So what are some risks associated with drinking? Well, one of these would be Korsakoff syndrome. So Korsakoff syndrome that happens with alcoholism causes a lack of thiamine or vitamin B1. These people have a B1 deficiency. When somebody has a B1 deficiency, it causes something we call alcohol amnesic syndrome. Basically, the people have short-term memory loss. So this happens specifically with alcoholics, and it's another one of these reasons why avoiding excess alcohol consumption is a bad idea, or not a good idea. In addition to this, we know that there's an increased risk of breast cancer associated with consuming alcohol. So for example, the top of this article from WebMD shows drinking as little as half a glass of wine a day may raise a woman's risk of developing breast cancer. So we know this. There's a link between alcohol consumption, what it does for different hormones in the body, for premenopausal, postmenopausal women. And in addition, something else to keep in mind is breast cancer risk is there for men as well. So it's not just women that this could be related to, but there could also be increased risk for men when dealing with alcohol and alcoholism. And the other example we'll give here, obviously, is liver cirrhosis. So what is liver cirrhosis? We see an image here on the right-hand side. On the left of that image, we see a nice, healthy liver. And on the right side, we see a cirrhotic liver, one that actually has lots of fatty infiltration. So this happens in 20% of the cases of alcoholism. Fat infiltrates into the liver. This causes enlarged fat cells. Then these large fat cells choke off other nutrients. They choke off oxygen, and it causes these fat cells to burst and die. And so when those cells die, it causes scar tissue to reside in the liver, and obviously that's going to block blood flow and everything else. Now, once cirrhosis occurs, there's a 50% chance of death within 4 years of the individual. Advanced stages of this disease are not reversible. Once cirrhosis has occurred, it is there. We cannot reverse this. We don't know exactly how much somebody needs to intake to cause liver cirrhosis. It can vary a little bit person to person. However, we know the damage of liver cirrhosis can occur in as little as 3 drinks per day for men or 1.5 drinks for women. Besides thinking about your own body, sometimes you have to think about fetuses and embryonic development. So in this case, we can talk about alcohol use while pregnant. During the first trimester is the most critical period for brain development for the growing infant inside of the woman. So in this case, what we see here is that the risk of fetal alcohol syndrome, or a disease, a disorder of children that's associated with alcohol intake, occurs during that first trimester. Why is that? Because at this stage, the embryo does not yet have a liver. So if a woman consumes alcohol, even though she's got a liver to metabolize it out, this infant doesn't. So what happens is the embryo takes in the alcohol because it's passed through the placental barrier to the infant, but then they can't process it, and it goes to the brain, and alcohol is obviously a poison, and it can damage the brain. It results in something called fetal alcohol syndrome. In this case, we can see with this is because excess alcohol reaches the embryo or fetus. They can't metabolize that alcohol, and it can result in physical deformities, intellectual disabilities, irritability, hyperactivity. On the right-hand side, we can see the symptoms, the outward showing phenotype that we see of somebody with FAS. But keep in mind, even associated with this, alcohol, tobacco, illicit drug intake should all be eliminated during pregnancy. It's not just alcohol that's dangerous. All those things are. So what do we know about alcohol use and alcohol abuse in general? Well, we know alcohol abuse contributes to 5 of the 10 leading causes of death. These are heart failure, certain cancers, cirrhosis of the liver, motor vehicle accidents, and even suicides. They all can be a result of alcohol abuse. When you combine that with tobacco, alcohol and tobacco, it increases the risk of esophageal and also oral cancer. There's also an increased risk for lots of different cardiovascular diseases, osteoporosis, brain damage, etc. We know typically alcohol abuse can reduce a person's life by up to 15 years, and every year annually the U.S. spends $185 billion on lost productivity, premature deaths, direct treatment expenses, legal fees that are associated with alcohol abuse. For example, a liver transplant. If somebody needs that because of liver cirrhosis, it costs about $600,000 to do just that one procedure. So what do we know about then alcohol dependence, which is alcoholism? It's the most common psychiatric disorder. 13% of North Americans have it. The person experiences repeated alcohol-related difficulties. They have trouble controlling their use. They'll continue even because of physical, psychological consequences. They might start to develop liver issues. They keep on drinking anyway. They might lose their job. They keep on drinking anyway. So we know that they're going to have these repeated alcohol-related difficulties, and they can't get over it because there's a dependence there. We think that there's a genetic influence associated with it. We know that certain people that go towards alcoholism have a tolerance to alcohol, and those people should also be aware of their alcohol consumption. So usually children of alcoholics are 4 times more likely to become alcoholics themselves. So we know there's some sort of hereditary factor playing into play here, but we don't quite know what genes are associated with it yet. What we do know is that if we have alcoholics in our families, we should tell our children about this and the dangers of alcoholism, usually by the age of 10 to 12, so therefore they're aware of it because that's when they might first become exposed to it as growing up. Long-term drinking, though, it poses a risk for everyone, and so it doesn't matter even about people that have it in their family, etc. For alcoholism, we all have to watch our alcohol intake because anyone can develop alcohol dependence. So how are we going to diagnose this? Again, physiological dependence of alcohol. We're going to see things in these people, for example, trembling, slurred speech, an unsteady gait. Many experience more stress to have alcohol dependence. These people, and if you've read the book Leaving Las Vegas, which you see a picture of on the right-hand side, the main protagonist, he had shaky hands. So usually when people are alcoholics and they stop drinking alcohol, they experience hands that shake, hands that flutter because the alcohol actually stabilizes and steadies their hands for them. There's lots of different alcohol-associated illnesses, memory loss, blacking out, liver disease, etc. And we can see that in those sort of people. If we look at alcoholism, we break it down by what happens when a chronic drinker versus a sporadic drinker drinks, we see 2 different scenarios. So this is from the table from your book, but we can see with a sporadic drinker, the second they start drinking and had 1 or 2 beers or any sort of alcoholic drinks, they're going to get euphoric. They're going to get gregarious. They're going to become uncoordinated. But in a chronic drinker, even up to about 4 beers to 5 beers, there's minimal or no effect that is outwardly visible on this person. Their BAL, their blood alcohol level, is still going up, but outwardly they don't show it because they become tolerant to alcohol. And even if you look at, for example, when you get up to the point of somebody falling into a coma or dying that's a sporadic drinker, for the chronic drinker, they may become a little drowsy or slow or start to show impairments. So they've really become tolerant to alcohol, but it's still impacting their body. To help people understand if they're at risk of alcohol abuse and if they're dependent, we use something called the CAGE screening. So CAGE is for CAGA. Have you ever felt you ought to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? And do you ever need to drink first thing in the morning to steady your nerves? Again, that going back to the shaking and wobbling hand, otherwise an eye opener. Positive responses to any one of these, so 1 out of the 4 is fine, could suggest an alcohol problem. In those cases, it's best to talk to a physician, get counseling, and if there's an alcohol dependence there, the only solution is total abstinence. It can't be, well, I'm just going to cut back. It's a total abstinence idea. Alcoholics Anonymous helps with this with their 12-step program. There's other treatment programs, and for true alcoholics, there's also medication that's really essential there because, again, as somebody comes down off that, there could be some cardiovascular issues associated with that, so they need to be walked down actually in a treatment center and not just try to go cold turkey. For everyone else, when considering alcohol, there are dietary guidelines. Moderation is the key, the same as with any sort of thing consumed, all right? No more than 1 drink per day for women is associated with good health. No more than 2 drinks per day for men. There is, of course, a possible lower risk of cardiovascular disease with moderation, but there's also little benefits for younger people. We notice that these benefits typically kick in around the age of 40. So younger than that, 0 benefit at all from taking any sort of alcohol in daily. And over the age of 40, maybe 1 drink a day for cardiovascular health. But again, non-drinkers should not start drinking for health. We know there's more risks associated with drinking than benefits. Instead, if you are going to drink, make sure you do it socially, with meals and with friends only. Never drink and drive, and always avoid drinking while pregnant. So that's really it for this lecture. I hope you found this information interesting on alcohol use and how to avoid alcohol dependence in your lives.